Chapter 8 in the first aid book deals with bleeding. There's a lot of different types of bleeding, and obviously bleeding can turn bad really quickly if we don't take care of it. Imagine that we have about 5 to 6 quarts or 5 to 6 liters of blood in the body, and any type of rapid blood loss can lead to shock and death. So if a person is hemorrhaging, they're losing a large quantity of blood in a very short amount of time, and that is a life-threatening situation. If the blood is coming from an artery, you'll see it spurting out of the body. If it's coming from a vein, you'll see it flowing, and if it's coming from the capillaries, it'll be oozing. So you'll be able to determine where the bleeding is coming from, which type of vessel. The body responds to bleeding. So the vessel starts to spasm, clotting starts to form as the platelets form a clot. It protects the wound by creating a covering over it. You have to be careful when taking care of bleeding victims. Wear gloves. If you don't have gloves, improvise with other materials. Make sure you expose the wound to find where the bleeding is coming from. You want to take care in handling any type of injury that occurs with bleeding. Place a sterile gauze pad or a clean cloth over the wound while you're applying direct pressure for about 5 minutes. If that doesn't stop the bleeding, then you have to add more dressings and press harder. You may have to apply a pressure bandage over the dressing, over a wider area of the skin. If the bleeding still continues, call 911. You might want to consider a tourniquet. That would help if with severe bleeding in the leg or arm if it can't be stopped. Make sure when you're done you dispose of your gloves and wash your hands. You need to care for the wound. If you need medical care for cleaning or stitches or tetanus immunization, make sure that is taken care of. If you have a manufactured tourniquet, you can apply that. If not, you can improvise a tourniquet. Whether you're using a manufactured one or an improvised one, you need to write TQ and the time it was applied on the forehead so that the EMS will know how long that tourniquet has been on. And of course, you need to call 911. You can also apply what's called the hemostatic dressing if direct pressure is not effective or if a tourniquet is not available. The tourniquet is usually applied about 2 inches above the wound. So if you have a manufactured tourniquet and you apply it above the wound, you want to twist the rod until the bleeding stops and then secure the rod in place. Again, as you see in the photo, just put a piece of tape over the person's forehead, writing TQ for tourniquet and the time it was applied. If you can't have access to a manufactured tourniquet, you can use an improvised one. Use a triangle bandage, roller bandage, or any kind of cloth that's folded into a long band that's about 2 inches wide and several layers thick. Wrap the band twice around the arm or leg, 2 inches above, and tie a knot. You can place padding underneath the band as well. Place a short, rigid object onto the knot, tie a square knot over it, and twist the object until the bleeding stops and secure the object. Again, same, write TQ and date, time that it was applied. Internal bleeding, you need to look for bright red blood from the mouth, rectum, or blood in the urine, vaginal bleeding, vomited blood, black, foul-smelling stools, pain or tenderness, bruising or swelling, broken ribs, bruises over chest, or rigid abdomen can all have signs of internal bleeding. So you need to monitor breathing, expect there might be vomiting, treat the person for shock, and also seek immediate medical care. If there are bruises, you can apply an ice pack for 20 minutes, and you can also put an elastic compression bandage over an arm or a leg, and that will help. So that is it for chapter on bleeding. Again, this is a brief overview. Please make sure you're reading your chapter and watching any other videos or anything else that's included in this week's material that will help in learning the material.